Hello, good evening. My name is Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Today is Tuesday, the very first day of February 2022. And today it's also a very good opportunity to thank you guys for your support, for all you've done for this channel to keep changing lives. Remember, our channel is simply focused on helping the community, especially women that are having problems becoming mothers and men that are having problems becoming fathers. Now, in line with our community and in line with the new month, this evening we're going to look at 5 top things you have to stop doing if you are planning to become a mother, if you are planning to become a father in 2022. 5 top habits, lifestyle, or things you might be doing. Sometimes you might be doing them without even knowing. If you can work on stopping these 5 things in 2022, I can tell you this. You are nearer to becoming a mother than you ever think of. You are nearer to becoming a father than you ever think of. So please, when you come in, make yourself comfortable. Make sure you can hear me clearly. And I'm going to start very soon. Once I'm done with my presentation, you will have an opportunity to ask me questions one-on-one. Please remember to click on the subscription button. It's very important for the community. The more we have people that know about the channel, the more the channel is going to grow, the more the community is going to grow, the more we're going to help a lot of people. There are so many people that need this help, like every single day. So for every like, for every comment, for every subscription you make, someone is going to be helped to start their family. So please make use of that subscription button and tell people about this channel. There are so many important videos that will help you to become. So please keep all your questions. When I'm done with my presentation, I promise you I'm going to take care of all the questions. None will be left behind, okay? So let's get started. You see, we've been talking about the things you should do so you can improve your chance of becoming pregnant. But this evening, we're going to talk about the 5 top things you should avoid to make sure you're pregnant in 2022. Number 1, we have to talk about exercise. Now, exercise is our friend, but exercise can also be our foe. So exercise is like the fire. If you do it better, it will help you. If you over-exceed, it's going to harm you. So especially for the women. So I'm going to use my teaching model to demonstrate. So for the body of a woman to function properly the way God structured it, you are supposed to engage in moderate exercise. So number 1 thing you have to do is to stop overdoing your exercise. Stop going to the extreme. When you go to the extreme, you're going to stretch your body. You're going to disrupt your whole normal hormonal balance. So there's a particular level of metabolism that your body is supposed to function properly. When you exceed that level, you're going to upset the balance. When you upset the balance, your estrogen is not going to be within the normal level. Your progesterone is not going to be within the normal level. Your FSH, your LH, these are all important hormones that will help you to become pregnant. Now, ultimately, when that happens, you will not release your eggs. Remember that every woman has all the eggs she needs to start her family. So stop excessive exercise. Don't go to the gym and you live in the gym and until your body is really extremely hurting you, then you think you're doing something. You need to be very mindful. Now, on the other spectrum, there are so many women that are not even exercising at all. That's also as deadly as over-exercising. So I want it to be in the middle. So if you're a couch potato, if you are not exercising at all, start exercising. So number 1 thing you have to stop, it's over-exercising and not exercising at all. I want you to engage yourself at least 30 minutes every single day, whatever works for you. Do you know that singing and dancing and hopping and walking is a form of exercise for 30 minutes? Anything that moves you from that one place to the other is a form of exercise. So I encourage you to go out there in the neck of the woods and start doing the right things. Now, number 2, this is an area that so many people will say, oh, I'm a woman. I'm not smoking. But guess what? Smoking might be directly smoking, which is called primary smoking, or secondary smoking, which is indirect smoking. Now, anywhere you see smoke, run away. Do not smoke, whether directly or indirectly. So directly means you light the cigarette or you light whatever you want to smoke and you actually inhale it and smoke it. It has direct impact on your ability to become pregnant. So every other thing might be okay, but this one aspect of your life might go wrong. So no smoking, both directly, both primary smoking or secondary smoking. So if your partner is a smoker, work on it. Excuse yourself, do something. Then your partner also should be on the same page. Becoming pregnant is a game of team. It's a team game. So your partner will do his own, you do your own, and both of you will succeed in becoming pregnant. So no smoking, no primary smoking, no secondary smoking, no tobacco, no weed, no drugs. In this era of smoking a lot of things, avoid it. Now, besides the fact that smoking will affect your ability to become pregnant, smoking can also harm your health, including leading to cancer. So you don't need it, especially if you have other risk factors, which can also potentiate your ability to become pregnant or to develop problems. So please avoid smoking. So I've mentioned two strong points. Work on your exercise. Don't overdo the exercise. Go on moderate exercise. Avoid smoking. Primary smoking, secondary smoking, no weed, no tobacco, no drugs. Now, the third thing you have to stop doing, majority of people are doing this without even knowing. You have to stop drinking the harmful stuff. You see, sometimes you think you are living a life of affluence, but you're actually the person stopping yourself from, becoming pregnant. Lately, when we were growing up, having women drink alcohol, it's something we shy away from. Now, I'm not trying to discriminate between women and men, but in our own culture, women are not really known to drink alcohol to stupor. But lately, a lot of women are drinking alcohol. Do not wait till you're confirmed pregnant to stop avoiding alcohol. Start today. Alcohol is just one of it. I'm going to come to the other one. So avoid alcohol completely in 2022, both for you and your partner. I know it will be difficult for some men, but guess what? We are thinking of starting your family. So avoid your alcohol. Now listen to me carefully. Avoid your soda. Alcohol and soda are brothers and sisters. When you condemn alcohol, condemn soda, they are the same thing. You don't need them. So avoid alcohol. Now also add to your alcohol Zobo. If you have all those locally prepared drinks, they go through a lot of fermentation and most times they produce alcohol. So avoid your Zobo, avoid all your soda. I'm not going to mention the names. You know the ones you're drinking. They are not sign that you're rich. They are not sign that you're doing well. You are actually putting things that will stop you from becoming pregnant into your body. Now work on your coffee intake and a couple of other caffeine-contained products. Coffee can help you temporarily, but we've discovered that people that want to become pregnant should moderate their intake of caffeine product. And coffee is top on the list. Now, my people, sometimes, in course of science, we will say, oh, drink this quantity, oh, don't drink this quantity. But I always want to take extreme precautions. So I will say, avoid your coffee. You can drink your tea. You can, maybe add milk and a couple of other beverages there, but avoid coffee. Make it a conscious effort to avoid coffee. Guess what? When you are avoiding all these things, you're saving a lot of money. Believe me, if you form the habit of buying Starbucks and all those stuff, every day, you're spending a lot of your money. If you form the habit of smoking and doing all those stuff or going out and spending all those money, these are money you can save and you can use it to save your family or to go for fertility treatment. So a drop of water can rain. No matter how little you've saved by stopping your soda, by stopping your alcohol, by stopping your coffee, you can put it in a piggy bank. Then you can plow it into what you need to do. Now, some people take a lot of energy drinks, Red Bull, this, that. Stop it. Now, I'm talking about people that want to become mothers in 2022. Stop all this. Look, we've had enough. There is no competition. So avoid your energy drinks, avoid your espresso shot, avoid your coffee, avoid your soda, avoid your Zobo, avoid alcohol ultimately. Now, number 3 point. Listen to me carefully. So many people are not getting it right when it comes to sex. Remember, the natural way you can become pregnant is through what? Having sex with your partner. So many women are not doing it the right way. Our group is based on PPP. We pray and we encourage women to make love 48 hourly. Now, stop timed sex. It's no longer viable. Stop timing your sex, especially based on when you think you're ovulating or when you think is your fertility window. It can fluctuate. It's not reliable. Stop waiting for a particular time you feel you're fertile to engage your partner. It doesn't add up. You're gonna delay yourself. And unfortunately, once you miss that chance in a month to become pregnant, you start all over again. Assuming you have 28-day cycle. Once within that 28-day cycle window, you miss that particular time you're supposed to become pregnant, you wait for another 28 days. So if you missed it in January, you are doing your ovulation sex, fertility window sex, you can swear by Amadioha that this is exact time you can be pregnant. It doesn't work, especially if you're older than 35. So what works? 48-hour lovemaking, regular lovemaking. The more you deposit the sperm inside the vagina, the more the sperm can get to the cervix and enter the womb, the more you're increasing your possibility of becoming pregnant naturally. So please, no ovulation sex, no fertility window sex. What do you need? 48-hour lovemaking, non-stop. Now, the next thing I want us to talk about is drug abuse. So many of our women are getting it wrong. You've been trying Clomid by yourself. You've been trying a couple of suggestions that your friends gave you by yourself. It's drug abuse. The same way you abuse anti-malaria, antibiotics, and a couple of other medication helps. You're very easily carried away. Anything anybody recommends, you present yourself as a guinea pig. You want to try it out. Don't do that in 2022 if you want to become pregnant. So avoid drug abuse. Do not take any drug besides your paracetamol or maybe ibuprofen sometimes. Please don't go binging on paracetamol. Please don't go binging on anti-malaria, antibiotics, and importantly, your Clomid. When you don't have a need for Clomid and you're taking Clomid, you are down-regulating your body. You are not helping yourself, because if you are producing X and the problem is coming from the tubes or the problem is coming from another place, but you are now pumping your body, you are punishing your body because your body doesn't need Clomid. Clomid is only given to women that have ovulation problems. If you have to use Clomid, it must be prescribed by a fertility specialist and must be monitored. Not every woman will need Clomid. Please, I'm telling you what I've seen, my experience. This is the best way to go. So no Clomid, don't binge on Clomid. If you have it right now, go and discard it. Okay, no herbs completely. Herbs and modern day medication is like day and night. You have to choose if you're going to be in the night or if you're going to be in the day. You cannot be a member of our group and you're still taking herbs. You're damaging your body on so many ways. So no herbs, no Clomid, no concoctions. So many people can swear by whatever that, oh, if you take this, it's going to do this. Have you ever seen a drug that can take care of fibroid, endometriosis, infertility? They sell it in the boxes. They tell you guys, oh, take this and magic is going to happen. It doesn't happen that way. So avoid them. Now, lastly, this is going to be a bonus. Now, some women, maybe because of experience or whatever, they don't really derive joy when they have to go on this PPP journey. You see, when you're not in the right place and you're meeting with your partner in regards to lovemaking, if you don't have adequate foreplay, if you don't desire your partner, if you're not at rest, if you're stressing, it's going to be painful. Simply because you're not ready. Simply because you're not helping your body to release the hormones, to release the fluid that will make the vagina ready. When this happens, some couples will resort to taking lubricants. Now, be very, very careful. There are some couples already contending with low sperm count. So imagine having low sperm count and the fewer sperm you can produce, which you might be lucky to have good motility or good morphology, you are now using spermicides. So some lubricants contain spermicides. Spermicides are chemicals that will kill sperm. So imagine your partner battling with low sperm count or even azoospermia. Then in course of lovemaking, because you're not playing your role, because of your partner is not playing her role, you guys will now introduce another enemy. So some lubricants are your enemies. You don't need them. If you have to use lubricants, use fertility-friendly lubricants. I'm going to mention two. Baby Dance and Presate. Baby Dance and Presate. They are the user-friendly lubricant you can use. They protect the sperm. They help you to at least, enjoy that lovemaking experience. Lovemaking is supposed to be lovely and supposed to be fun. The moment your lovemaking is bitter, then it's no longer lovemaking. We have to remove the love and call it bitter making. Okay, so that's my presentation this evening, and I'm going to open the clinic and give you an opportunity to ask your questions. My COO is in attendance. Thank you so much, Kenneth, for coming. Please, this is an opportunity to get feedbacks from me. This will be a very good way to start 2022 February. You cannot go through this route again. So please, the floor is open, and please ask your questions in real time. What's the meaning of uterus position? Your question is not complete, madam. So anywhere you see uterus, you're referring to the womb. Okay, now the orientation, that means the positioning of the uterus can either be tilted towards your navel, towards your belly button, or towards the pubic bone. If it's tilted towards your belly button, it's called forward-facing womb, or what we call anteverted womb. Now, some people can have retroverted womb. It doesn't matter the position. So long as the womb is completely developed and we don't have any problems, you can use that womb to become pregnant. Okay, so it's not a factor at all. The only time we might have a problem with the womb is if we have structural problems. Maybe the womb was poorly developed, or the womb was, bifurcated or bicornate womb. Couple of things that can happen. Very rare. When that happens, then the ability of the woman to become pregnant and sustain the pregnancy will be compromised. Okay, but besides that, you don't have any problem. Okay, what can someone take for? I want to believe you're talking about reduction in your progesterone and estrogen, right? Now, let me orientate you, my dear. We don't go about taking stuff, okay? First of all, we have to have the right diagnosis. You see, it's very easy to go to the lab and you see one particular test, which might be out of range, which might be a false positive. It can be a false negative. It might be an alarm. That's not the right thing. Personally taking yourself to the lab and having the lab people give you a result and you start freaking out and you start shopping for drugs by yourself, completely not the best route. If you have concerns, present yourself to a doctor. If it's a female-related problem, then a gynecologist. A gynecologist will tell you specific tests you need. Then you go to the lab. Then when the result comes out, you take that same test. You go back to the person that gave you the order, then we'll interpret it. Now, once your hormones are not within the normal range, then you have hormone imbalance. So if your progesterone level is low, then the possibility of even succeeding in becoming pregnant will be compromised. Now, in the event you succeed in becoming pregnant with low progesterone, the higher risk of losing the pregnancy is there because progesterone is pregnancy maintaining hormone. So if you don't have adequate level of progesterone, you are likely going to have miscarriage or stillbirth. The same thing is applicable to your estrogen. Okay? Now, please keep asking your questions. Keep asking your questions. Remember, today we're talking about the top 5 things to avoid, to stop in 2022 to become pregnant. Top 5 things. Number 1, avoid excessive exercise. In line with the same exercise, avoid not exercising. You have to exercise. Avoid smoking in any shape or form. Primary smoking, secondary smoking. Primary means you're the person that will light the cigarette and you will smoke, or you hang around people that smoke. Avoid all forms of drugs. No drug abuse. Don't abuse your Clomid. Don't abuse your anti-malaria. Don't abuse your antibiotics. Now, you have to also be mindful of what you do every single day regarding looking after yourself. There is no other time you have to get it right but now. So these are the few things you can do. And if you do them, I promise you, you're going to see result. No time sex. Because the body of a woman is so funny. Unfortunately, the life of the egg and the life of the sperm, they are completely different. For some reason, God gave men a lot of advantages. When the sperm is deposited, it can survive in the vaginal cavity up to 7 days. Think about that. But when the egg is released, it dies off within 24 hours. So if you didn't get it right in your calculation, this is not mathematics. Once that egg is released, let me give you an example. You're targeting your ovulation. And suddenly you notice you have increase in your cervical egg white mucus, you have some mood swings, you have mid-cycle pain, you probably spotted, and you can swear that this is your ovulation. Then you waited for your partner to be ready. Meanwhile, you've already ovulated, though. You didn't even know you've ovulated. Before you even began to sow those things, you've ovulated. And the egg is supposed to last for 24 hours. Guess what? When you sleep in the night, you have already lost a chunk of time. An average sleeper, let's say you sleep for 8 hours. So assuming your egg was released when you were sleeping, then probably you need to go to work. By the time you now come back to time down your sex, the egg is already gone. But if your partner deposited sperm in your vagina a day before, if that egg wants to come by 1 a.m., the sperm can still go and get you pregnant. So your partner can make love to you on Monday and comfortably get you pregnant on Wednesday. It works. Okay? All right, let me see what my admin means. Okay, how does one know what's moderate? So this is a very technically based question. So it's all about, mindset. It's all about, looking at your body. Personally, I'll use, individual experience. You see that point, you're in the gym or you're doing whatever, and you feel that your muscles can no longer carry you, and you can feel that pain, but you want to lose all those weight in one day. That's extreme. If you are in the treadmill and you know previously you can tolerate 20 minutes, but suddenly you want to go to 2 hours, that's extreme. If you want to go the extra mile or you have competition, you're competing with people, you're no longer eating, you're living in the gym, you go in the morning, you go in the afternoon, you go in the night, that's extreme. That's not right. When you do that, you're going to flip your body will be confused, your eggs will be confused, the hormones will be confused, and you will not become pregnant. So avoid that. If you pay attention to women that are into sports, majority of them will not start having kids until they stop being into sports, until they go into retirement. If you pay attention to them, once you stretch the body of a woman, you confuse the reproductive system, and sometimes it's not the best. Okay? All right, please keep asking your questions. I need more questions. We still have about 8 minutes. Keep asking your questions. Remember to subscribe. Remember to tell people about this channel, even if you're not going to watch in real time. Make conscious effort to set your notifications so that even when you miss the live video, you can always come back and ask your questions, and you can always get feedbacks. If there is anything we love in our community, we love our women, we love our babies. We don't just want you to become pregnant. We want you to become pregnant and also have a good outcome. Okay? Keep asking your questions. Please keep asking your questions. Questions. I'm ready to take care of your questions. What's the cause of hot flashes? Okay, now what you might feel as hot flashes can be a lot of things. So until we've ruled out completely that is hot flashes, then it can be infection, it can be allergy, it can be growth, it can be inflammation. But if you have classical hot flushes, I need to know your age, because hot flushes might be a sign of menopause. When your hormones are changing, when your estrogen is down and your FSH is going up, you begin to have changes in your body, which is telling the body that you're about to go into retirement. Most women that will be in menopause will have hot flushes. So hot flushes means you have this gush of hot air around your pelvic region into your vagina. You feel like you're sitting on hot something. Okay? Now, some women can also present with low libido and can also present with dryness. These are all changes because the level of estrogen, which ordinarily should help this thing, is coming down and FSH is going up. These are all preparations that every woman will go through. Once you're a woman, you're going to retire. When you retire, you go into menopause. When you go into menopause, you can no longer become pregnant by yourself because you no longer have eggs. You can still become pregnant with donor eggs. Now, sometimes hot flushes might also be a sign of hormone imbalance. Sometimes it might be due to your thyroid hormones and a couple of things. So the best thing to do is, if you experience this, like I'll give you an example. Some women might have hyperthyroidism. It means that the thyroid hormone, which is a gland in front of your neck, is overfunctioning. So in those women, when other people are feeling cold, they will be feeling hot. They will be sweating. So it can also be a sign of thyroid problem. Now, some women can have the opposite, hypothyroidism. When other people are feeling very, very hot, you're feeling cold. So there are so many things that go on in the body of a woman. The most important thing you have to do is to consult with your fertility specialist, or at least your gynecologist. Okay? What can a couple diagnosed with unexplained infertility do? I love this question. So this is what you need to do. First of all, we need to confirm that it's actually unexplained. So we need to take a lot of history. We need to ask you a lot of questions. We need to examine your body, examine the woman, examine the man. Then we need to send you on investigations. Once we have confirmed that there is no history, problem of, whatever you guys are going through from the history, which we will get. Once we confirm that examining both of you, we can find where the problem is. Once the labs come out, your hormones are good, his hormones are good, the sperm count is okay, everything is okay, your tubes are open, but still, you guys are not able to achieve pregnancy, then we need to begin to seek alternative help. We can place you on fertility drugs. We can start you on IUI with your natural cycle or IUI supported, and ultimately we can go for IVF. So there is a stepwise approach to treating infertility of unknown origin. So infertility of unknown origin or unexplained infertility means both of you are good, clinically, medically good, but still you're not able to become pregnant. Okay? Very important. I love that question. Thank you, Kenneth. Please keep asking questions. Okay? Ask your questions. Ask your questions, please. The more you ask me questions, the more I also learn. When I'm teaching, I'm also learning. Okay? But I need questions. Bombard me with questions, please. Bombard me with questions. Remember, today we're talking about 5 things you have to stop doing to become pregnant in 2022. Okay, I have another question. Please, what could be the cause of 2 miscarriages? Clinical, the gynecologist said you're fine. Okay, now my sister, unfortunately, miscarriage is very common. About 25% of most pregnancies will end in miscarriage. Most miscarriages, some women won't even know they miscarried. You see all those your delayed period that later came out in big clots. They might actually have been miscarriages. Unfortunately, majority of the miscarriages are caused by chromosomal problems. Chromosomal problem means when your father and your mother were coming together, your father will come with 23 chromosomes. Your mother will come with 23 chromosomes to form a 46 chromosome. So a human being is 46. You are a product of you and you're a product of your 2 parents. Now, in course of exchanging the sperm, so the sperm will have 2 different chromosomes, the Y chromosome and the X chromosome. The Y chromosome is the boy determining chromosome. The X chromosome is the girl chromosome. So it's actually the man that determines if you're going to have a baby boy or not. Now, when they are exchanging the chromosomes, there might be error. Anything that is faulty, your body wants to remove it. So most miscarriages, remember that miscarriage is unintended loss of your pregnancy before 20 weeks. Most miscarriages are based on mismatch or error when those babies are going through formation. Now, some can be by infection, structural problems, hormonal issues, trauma, and what have you. Now, if you have had 3 consecutive miscarriages, that means your last 3 pregnancies ended in miscarriages. It's called recurrent miscarriages. We need to stop right there and go invasively to see what we can do differently. So there are so many other things we need to look at. There's a particular condition we call antiphospholipid syndrome. So we need to do a couple of invasive investigations to see what we can do, to see what we can discover the problem. Some women can also have cervical incompetence. It means that the cervix is not strong enough to sustain the baby until term. So these are things we need to figure out. So once you've had miscarriage, don't be in a hurry to become pregnant again. Go back to the drawing board. Now, some women, when they eventually become pregnant, they need to be under extra care. So those women are called high risk. There are so many pregnancy factors that will place you in high risk. Number 1 factor that will place you in high risk is your age. Once you're 35 years and above, you are classified as a high risk pregnancy specialist. So a special doctor will look after you until you become pregnant. Okay? All right, guys. 1 more minute, then we're gone. Remember, YouTube clinic is every Tuesdays by this time, 6 p.m. Eastern time, 12 a.m. West African time. But during the weekend, we reverse it. We come a little bit closer. So during the weekend, it's my 12 p.m., your 6 p.m. So most weekends, you have an opportunity to participate. Okay, but thank you so much for coming this evening. I appreciate you. Remember to review every single thing. And I will tell you this for February. It doesn't matter what happened in January. It's okay. It's gone. Stay focused. keep on praying, keep on playing, keep on practicing, get help, budget resources, budget money, spend that money. Spend that money. If you have that money, go to the best. There should be no excuses. Don't keep your money in the bank and you're waiting for miracles to happen. Seek for the best person in your location that can help you. Don't waste time. This is the time you've been waiting for. It's going to happen in February. The beauty of February is the fact that it's very brief. There is the month of love. So go back home, keep on keeping on. Sometimes you listen to the noise and you miss the music. Can I please capture this for me? Sometimes you listen to the noise and you lose the music. So sometimes you'll be doing the right things, and within you, you think you're not getting results because you are focusing on sight. But somebody is growing in your body. There is a baby growing in your body. So long as you're in the right direction, you're going to get there. Sometimes you will be delayed. Sometimes you'll meet challenges. But it doesn't matter how you start. It's how you finish that matters. So it doesn't matter what has happened before. What matters is how you finish this February. So I'm encouraging you, no matter what has happened in the past, pick yourself up. Keep on praying. Keep on playing. Keep on practicing. Get up every single day and look yourself up in the mirror and say, I am a mother. I am a father. And 2022 is my year of reckoning. And I'm telling you this because I cannot wait to celebrate your baby in this platform. So please, meticulously stop smoking, stop alcohol, stop coffee, stop excessive exercise. Don't use your unfriendly lubricants. Eat properly. Sleep. Avoid stress. Drink only water. When you do all this, you don't even know what's coming your way. We have twin mothers. We have triplet mothers. We have quadruplet mothers. In this group, nothing can stop you. It doesn't matter what people are saying. It doesn't matter what the societies are saying. Some of you might have been reading up. Some of you, they've already given up on you. But the only person that will genuinely and truly give up is you. So long as you don't give up until you become a mother, until you become a father, is not over. What I'm telling you is what I know. Sometimes you need to have a pinfall to pick yourself up and you stay the mark and you keep your eyes focused, you will get there. Avoid the Broadway. Clomid is the Broadway. Everybody is Clomiding. Everybody is going to Owerri. Everybody is going to Poraka. Be mindful. Be careful. Be very, very careful in 2022. Okay? So God bless you and enjoy the rest of your evening. Now, tomorrow is going to be my first clinic for February in my community. Now, we have so many amazing. Have you seen the community lately? Have you joined the virtual admin in our group? Have you joined our community in Facebook? Have you seen my TikTok? Have you seen my YouTube? Have you seen my Instagram? There are so many amazing things happening. Make sure you convert this knowledge into concrete outcome. I love you guys, and I can't wait to celebrate you on this platform. Until I see you tomorrow, God bless you and enjoy the rest of the evening. Bye-bye for now.